What if the deck was stacked against us in managing type 1? I know that sounds like clickbaity, but I mean it. Like, what if we do everything right, according to science, and our blood sugars still don't line up with where we think they should be? But Dr. David Ahn told me something today that I have never heard before, and it is super helpful.
In one clinical trial, they gave patients with type 1 diabetes the same dose of insulin via pen therapy 2 days in a row, and they found that the amount of insulin absorbed from those shots varied by up to 20%. So that means you might even be taking the exact right dose that you need, but you may only absorb 80% of the insulin you injected. It's ridiculous. What I often tell my patients, or anybody with type 1 diabetes, is that celebrate the times where your blood sugars are tightly controlled. Take all the credit for it. You did that. You earned it. But when your blood sugars are just not behaving the way that you expected to, don't beat yourself up about it, because there's so many factors that are outside of your control, and try not to let it get to you. I know it's easy for me to tell you that, but hopefully some of these statistics will reassure you.
Take credit for the good days, give ourselves grace for the bad days. I hear you, Doc. I hear you. Remember, you're not doing a bad job, you're doing a difficult job. This isn't easy.